Welcome to Expert Profiles Atlanta, where Atlanta's influencers and innovators share strategies for overcoming obstacles and achieving success in business and life. Here's your host, best-selling author and Atlanta influencer, Neil Howe.
Hello and welcome to the show. This is your host, Neil Howe, and today's guest is Aimee Cassinelli. Aimee is a board-certified pediatric dentist with more than 15 years experience treating infants, children, and teens. Aimee is the founder of Peak Pediatric Dentistry in Atlanta. She is kid crazy, lighthearted, cavity creep fighting pediatric dentist. I like that, Aimee. Aimee is a mother of three. She considers herself an entrepreneur, a sugar bug buster, a visionary, a smile creator, a philanthropist, a girl boss, a lover of smiles. Aimee is an energetic and she's passionate about pediatric dentistry. She considers herself a lifelong educator, always striving to create positive dental experiences for children while teaching them lifelong healthy habits. You won't find a more dedicated and compassionate board-certified pediatric dentist in all of Atlanta. Her commitment to her patients' well-being is second to none. She leads a team of kid-loving staff who look forward to creating happy, healthy smiles. Welcome, Dr. Aimee Cassinelli.
Thank you, Neil. Thanks for having me.
Well, tell us a little bit more about Peak Pediatric Dentistry and the types of clients that you help.
Peak Pediatric Dentistry has been a long time in the making. I've been practicing for almost 16 years, but never for myself. I always worked for somebody else. I worked in Cleveland and in Pittsburgh before coming to Atlanta 10 years ago. I kind of picked up bits and pieces all along the way of exactly what I wanted in my own practice. And about a year ago, I opened the doors of Peak Pediatric Dentistry, providing the care and the quality of dentistry that I wanted all these years. So it's great to sort of embark in a new career as a business owner, even though I'm still doing the same things I did before as far as dental care goes. But we're really providing it in a way that I feel is very unique. Atlanta's a big city, and a lot of businesses have grown with the city into huge practices. And that's not what I want. So while we are at cutting edge of technology and everything you find in our offices on iPads, we have televisions on the ceiling for our kids, we are definitely high tech. I want that old fashioned dental practice where you come in and you know the doctor and you know the staff. Every time you come in, it's the same faces. Relationship development is really what I want to see. Nothing is more rewarding for me than watching my families grow and kids grow and babies becoming siblings and kids becoming teens. That's really the most rewarding part of my job. And my goal at Peak Pediatric Dentistry is really to develop the experience and the relationship over time.
Yes, that's so important, the experience. Unfortunately, going to the dentist has a negative connotation to many, and that's something that you definitely have to overcome. And having that experience, having a good experience is something that's definitely going to help that. So tell me, where did the name Peak Pediatric come from?
So Peak Pediatric Dentistry was actually created by my three children. We were on a vacation out in Montana, and we were on top of Lone Peak Mountain when I received the phone call that my lease had been signed and we were ready to start the practice. I have a very complicated first name. It's Aimee, but it's spelled differently. And my last name is very complicated. And so I knew that I needed a practice name that was short and quick, simple and easy to remember. And on the top of the mountain, as we were all celebrating the start of the practice, my kids said, "Why don't you call it Peak Pediatric Dentistry?" And we kind of laughed and said, "We're not in the mountains. We're in the middle of Atlanta." And then my husband said, "You're kind of at the peak of your career. You've been practicing for 15 years. You're not the new kid on the block. Why don't you call it Peak Pediatric Dentistry for the mountain and for the point you are in your career?" And then I realized when I got back to Atlanta and went back to work that every time I looked at a kid or examined a kid, I'd say to them, "Let's take a peek in your mouth." Now, peak is spelled differently that way, but between the three of them, I thought Peak Pediatric Dentistry is where I want to be. So that's how we decided the name Peak.
Excellent. Something that makes sense and is a memory from that time of signing the lease. That's awesome. Well, Aimee, talk to me about the people that you serve, because it's obviously the pediatric dentistry. you're serving children as your patients, but you're also serving their guardians as well.
Absolutely. Absolutely. A lot of our visit is child focused, but we need to take a portion of every visit to talk to the parents so that the things that we're doing in the office can be carried through to them at home. We really see children, truthfully, from newborns all the way through high school. So when they graduate from high school, they graduate from our practice. We really like to see kids around the first birthday. Our academy, as well as the American Academy of Pediatrics, recommends the first dental visit by the age of 1. And a lot of this is the examination, but more of it is talking to the parents, creating good dietary habits, teaching them about fluoride and fluoride use, teaching them how to brush their child's teeth. I feel that visit is so important to start laying the groundwork early that I actually offer it complimentary. If you're 14 months or younger and you come in for the first visit, we don't even charge you to do it. But that is the point that I can really make such a difference. When I see a kid who's 3 or 4 years old, sometimes it's too late. Those habits have already been established, whether they're positive or negative, and I can't do a lot to change them. So if we can see them at the age of 1, when they're cavity free, and we know they are, we can start to talk about the good things and the bad things for the teeth. So that first visit is really critical for me. And then we see them all the way through high school.
Very good. So talk to me about some of the problems. Obviously, at 1, they're cavity free, but things can go downhill drastically from there. What kind of problems and, what habits are associated with these problems?
So there's a rise in cavities in children. Nowadays, you would think with all the technology that we have and fluoride in our water and fluoride sources in our toothpaste, the cavities would be on a decrease, but cavities in children are actually on an increase. I think it's because of the choices in the grocery store. If you walk into the food and beverage aisles, there are more choices for drinks than we've ever seen before. We know that the only thing that helps prevent cavities is water. Any kind of a juice or a drink with sugar in it will cause cavities. So kids are drinking more Gatorade than they've ever had before, and more juices. That juice and soda aisle is huge. And unfortunately, that's what's causing the cavities in this generation of kids. So getting in and teaching them early that they want to be drinking water all day long and they want to be flossing their teeth and brushing their teeth makes a big difference. Kids that are crowded, kids whose teeth are closer together are more likely to get cavities than kids whose teeth are spaced apart. So looking at that, evaluating that, and teaching them how to clean their teeth when they're crowded is really critical as well. But those are some of the biggest problems that we face in our practice, is really what goes on when they're not in the office. The choices nowadays are just crazy. The other thing that causes cavities are sticky things. So with all the peanut allergies, sticky candies are peanut safe. So there are more kids eating Skittles and Starburst than ever before. Those stick in the grooves of the teeth and cause cavities. So I always tell my patients, think about chocolate. Chocolate melts, ice cream melts. Sticky things stick in the grooves of the teeth and cause the cavities. So really just sort of teaching them good dietary choices. Of course, they're kids, they're going to have sugar. But let's pick the right kinds of sugars to be eating versus the things that are going to get stuck and cause cavities. So we spend our days talking to them about what to eat, good choices, and how to avoid the dreaded sugar bug.
And what would you say the number one thing? Is it the actual sugary foods that they eat, or is it the drinks?
It's a combination of the two. It's the sticky things and it's the drinks. The sticky foods cause cavities on the chewing surfaces. The drinks cause the cavities in between. So I can usually look at a child and determine which one it is based on where their cavities are. Most kids don't have both. They typically have one or the other. It's either the chewing surface or it's the in-betweens. And we can kind of cater their diet according to what we see.
Interesting. And as far as once they get a little bit older, once you have the cavities and those kinds of things taken care of, what kind of issues do they have when they're growing with their mouth, like overcrowding or cross bites and those kinds of things?
So we do a lot of growth and development. My job as a pediatric dentist is to watch a child's mouth sort of grow through those phases. When they start to lose teeth, where they're going to put their new teeth, how their new teeth are going to come in, and how they're going to be aligned. I'm not an orthodontist. I send them to an orthodontist when it's time for braces. But I kind of consider myself the gatekeeper. So my job is to sort of watch and keep an eye on them and tell them when it's time to see the orthodontist. We can really catch a lot of things, though, by doing regular visits. So children will sometimes have an extra tooth or a missing tooth or a tooth in an unusual alignment. Those are the things that we can pick up early so that we sort of know where we're going and what we're planning in the future. But growth and development is definitely an integral part of my job. We can look at things like habits, so thumb habits, finger habits, pacifiers, and we can tell if they're doing damage to the teeth. Some kids do and some kids don't. But those that are doing damage with a habit, we can start to work on eliminating that habit. In our office, we do something really fun. We have a thumb trophy. And so we give them, it's literally a thumbs up, little metal trophy. And when they're done sucking their thumb, and they can come in and tell me, as proud as they are that they're not sucking their thumb anymore, we make a big deal about it. We give them a certificate and we give them this thumb trophy and make it a really big deal.
Awesome.
It's just a fun, another fun thing that we can do to sort of create that sense of pride in these kids with their dental care and their dental health.
Yeah, that's stopping those habits is extremely important. What other habits do you see oftentimes that are causing problems?
Oh, we see the pacifier definitely can cause some problems. But again, I always tell parents, I'd rather see a pacifier than a thumb habit. We can always get rid of a pacifier. And we give them all sorts of tips and advice for how to get rid of the pacifier and when to get rid of the pacifier. Those are really the two things. The biggest obstacles I have in my practice are habits and cavities. If we can get through those two things, we can get through anything.
So what are some of the misconceptions about children's dentistry? I know that fluoride is definitely one that people have different views on.
Yes, fluoride is definitely one of them. Everybody, has different beliefs in fluoride. I'm a big believer that fluoride works. We talk a lot about fluoride in the practice and how we feel it can most benefit the children of our practice. But there are definitely parents who don't want to use fluoride, and we're okay with that. We respect those decisions. We always note it and make sure that, we are not using fluoride or fluoride products on those particular kids. The biggest misconception with pediatric dentistry, though, is the myth, well, they're just baby teeth. Why are they important? They're going to fall out. And that is probably the biggest obstacle that I come across. Baby teeth are so important because they preserve space for the permanent teeth. So they are holding that space so that when it's time for the permanent tooth to come in, there's somewhere for it to come in. So as kids have decay, not only do they develop toothaches and pain, but they also begin to lose space. The cavities will break through on the teeth, and the size of the tooth actually shrinks. And when that happens, the teeth in front and behind come into the space, close the space, and then there's nowhere for that permanent tooth to come in. So in all honesty, baby teeth are nothing more than space maintainers, if you look at them that way. So preserving them is really important. And the back molars are there until the kids are 12 years old. So if you see a 3, 4, or 5-year-old with a cavity in a back molar, they have a lot of time that they need to use that tooth, and that tooth has to function. And so we want to preserve it. And of course, it's always easier to preserve it when the cavity is small. So a small cavity is a filling. A bigger cavity requires more treatment. So we like to be as uninvasive as we can and do as little as we need to do. So catching things when they're small is definitely what we like to do.
So those parents that think, well, it's only their baby teeth, they're going to get their adult teeth in soon. What dangers are there if they have a lot of cavities in the baby teeth? What happens to the adult teeth from that experience?
Well, we know that the adult teeth will come in more crowded. So it's going to they're probably going to more likely to require braces than a child who had a nice primary dentition. It also, the bacteria is in the mouth. So if we can eradicate the decay that is there, we are setting the stage for the permanent teeth to come in nicely. But if the permanent teeth start to come into this mouth of active lesions and active cavities, it just continues the bad cycle. So it's better to get rid of the decay and always have a nice, clean, healthy mouth so that the permanent teeth can come into that environment.
And as far as good habits when it comes to brushing and flossing, what are the recommendations for that? So
we want our kids brushing twice a day, and we want them flossing every evening. I always laugh because I see a crowded 2-year-old and I say to the mom, you really have to try to floss. And I know that's the last thing they're going to be able to do is wrestle that 2-year-old and floss at night. But trying to get in and do that really makes a big difference for us. So we really do try to encourage the brushing and the flossing. Brushing twice a day, flossing once a day.
And in your experience, is that something that you see happening? Is it habits that are developed in children, or do you find that most children will skip that process if they can?
I think when the parents are in charge, the kids are being flossed. When the kids start to take over their own dental care, when they're 6, 7, and 8 years old, that's when we start to see that things aren't being done as well. So that's our opportunity to jump in. We have an area of our office called the Sparkle Station, and it's set up to look just like a bathroom sink. There are 2 sinks and a mirror, and that's where we spend a lot of our time teaching kids good brushing and good flossing. We have something, I don't know if you remember them as a child, they're called disclosing tablets. They're little red tablets that they can chew up and spit out, and it marks everywhere that they've missed when they're brushing. Right. And that's a great teaching tool for us. So we bring them in at that age. We have them do that. They can see everywhere that they're missing, and that's more impactful than just handing them a toothbrush and telling them that they need to brush. So we really spend a lot of time with that age group trying to teach the good habits, because they're at the age where they want to be independent. Their parents want them to be independent, but they just don't necessarily have the skills to be successful. So that's where we come into play and really teach them how to be successful and how to clean their teeth.
So what do you specialize in as a practice, would you say?
So we really do it all. I'm proud to say that I'm a pediatric dentist that does all aspects of pediatric dentistry. But I think the one thing that we do that's a little bit unique to the city of Atlanta is our oral sedations. So a lot of pediatric dentists do preventive care. They do lots of cleanings and they'll do fillings. And if children have difficulties, they'll take them to the operating room. But sometimes there's something in between there where you have a child who's very anxious and who's very nervous and needs to have some work done, but taking the operating room just seems drastic. So I do some oral sedations, which I feel like is a great service. We give them some medication to drink that just relaxes them. So it doesn't put them to sleep, but it gives them enough relaxation that we can usually get in and get the work done that we need to do. That is sort of unique to my practice. I'm proud of it. I like that I do that. And I think we're really providing a nice service for kids that normally wouldn't have that opportunity.
And that is something that you have studied extensively, is the sedation part of the dentistry, right?
Exactly. I was very fortunate. I went to a residency program at Children's Hospital in Pittsburgh where we did so many oral sedations. A lot of residency programs don't specialize in oral sedation, but my residency program trained us to do a lot of oral sedations, and I've maintained my skills. Every practice that I've worked in has been a practice that participates in oral sedation. So I've always been able to maintain the skills and do what I like to do the most. And that's one of those things that I really enjoy doing.
So talk to me about some of the fears that your clients have, both the children and the parents, and how you get over them.
I think a lot of times counteracting the parents' fears. So they grew up in an environment where they did not have good dental care, or they didn't have a good dental experience. And so they are so fearful that trying to teach them that this is going to be a totally different experience for their child is sometimes my biggest obstacle. We really strive to do that. As pediatric dentists, that's our job. Children have a lifelong of dentistry ahead of them, and we want to make sure that we are setting the stage for them to enjoy the dentist and not hate the dentist. So teaching the parents that it's going to be a different experience this time around is really, the biggest obstacle with the parents. With the kids, I think their biggest fears are just sort of, is it going to be a shot? Is it going to hurt? They go to the pediatrician and they get a shot and they see it and they know it and it hurts. But truthfully, we can do an injection. They don't even know it. If they don't know they're getting a shot, they'll walk out of my office and not know that they ever had one. We do such great things now with our topical anesthetics. We can buffer our solutions. So shots tend to hurt because it's a very acidic solution that gets injected. We neutralize our solution so it doesn't hurt as much. So we can truly do that. If they don't know they're going to get it, they won't know that they had a shot. And sometimes that's the biggest obstacle to overcome at the dentist. So just showing them and teaching them that, hey, this isn't such a bad experience is usually what we feel like we do best. And those are our best successes when we can do that for a child.
Well, definitely having children myself, I know that that's something that they always worry about is, am I going to get a shot? But,
right.
To not even know if you did is a good solution to that problem.
Right.
Sure.
Now, occasionally I'll look at a kid, they're a second or third born child, and the older siblings will be there, and I'll tell the little kid they have a cavity. And the older siblings will say, oh, it's going to hurt so much. And they start to scare the kid. And I'll look at the mom and I'll say, you know what, we should do this today, because if you send them home, these other two are going to get to them and really scare him. And so sometimes we'll just do the treatment right there so that they don't have to go home and hear it and wonder and worry and have angst about what's going on. So I feel like sort of gauging the environment and the family life and what's going to happen when they leave our office. I always tell parents, do not talk about the next visit. Let me do everything. We kind of have keywords and magic words for everything we use. And if the kids come in with preconceived notions, even if you're trying to do the right thing and prepare them, sometimes they just have different ideas in their head. So we really, really enjoy being able to take a kid through a process and have it be new to them, because we can really mask it and hide it and use great words for them where they don't mind being there and having whatever we have to do done.
So talk to me about some of the health problems from having bad teeth, because I know there's a lot of correlation between having bad oral health and heart disease. What other things are important when it comes to, just having that proper teeth that people might not think about, that it's affecting the rest of their life?
Right. So we know that 1 in 5 children have untreated tooth decay, which is a pretty staggering number. We know that there are 51 million hours of school lost related to dental problems. We know that 44% of children have cavities before they even enter kindergarten. It is 5 times more common than asthma to have a cavity. It's just a staggering problem. But you're absolutely right. It can affect overall health. So the worst case scenario for us with pediatrics is typically that an infection gets to a point where it can be dangerous. So, you think it's just a tooth, you think it's just a baby tooth, but that infection can eventually can drain into the other spaces of the face and can cause serious infection, hospitalizations, those kinds of things. So with pediatric dentistry, we don't necessarily see the long-term effects of dental decay and untreated decay as much as we see sort of the immediate needs that if kids have untreated dental caries, they're going to end up with a toothache. If their face starts to swell, it can be dangerous. It can be scary, and they can end up hospitalized. So those are the things that we really work to try to prevent. We don't see it very often, but it is out there and we do see it.
But ultimately, at that age that you're treating now, they're setting up their habits for the rest of their life. So if they don't get them sorted at that age, the likelihood of them having problems later in life are pretty big.
Absolutely.
So give me an example of somebody that you've helped, somebody that really sticks out in your mind. What kind of issues they were having when they came in to see you, what problems they were facing, what were you able to do for them, and ultimately what was their outcome?
So some of the most rewarding children that I treat in the office are children that are adopted from other countries. I can think of a few kids just off the top of my head who have been adopted from China, and they're a little bit older. So they're 3 or 4 years old. So they've had their teeth for a while, and they come into the United States. And I'm usually one of the top priorities because these kids have had poor oral care in China. And so the adoptive parents bring them into me pretty much as soon as they're seeing the pediatrician because their teeth are in such bad shape. And so a lot of those children require extensive dental work. But for me, it's rewarding because I meet them usually within a few weeks of them coming to this country, and I can watch them grow and develop. So I see a kid who is really unsure of all of his environment and all of their surroundings the first time they come to me. And over the years that I treat them and I see them, I realize that what love can do and how these parents have brought these kids over here and how they've given them a great environment and a good home life, and they've shown them love, and these kids just blossom into wonderful little individuals. And so for me, that is so rewarding to just see sort of what love can do and where families can take kids. And so along the way, of course, I help them and they end up with great dental care, but they really watching the sociodynamics of it is just amazing for me.
Yeah, well, I've got the experience with that myself. We adopted a kid from Latvia, and You're right. One of the first visits was to see the dentist, and And thankfully, his teeth were in really good condition because he wasn't used to eating the candy and the soft drinks and everything that we have over here.
Right, right.
But, as soon as he got over here, and I think, a trap or a habit that these adoptive parents can fall into is giving them all these things, like all the sugary things right away, because they might not have had access to it where they were. And that didn't help his teeth any. He ended up having problems with his teeth. So he had to go back to the dentist. Yeah. I'm sure.
But yeah, it's a reward. It's very rewarding to see that.
So tell me, Dr. Cassinelli, what is one lesson that you learned early on in your practice that still impacts how you do business today?
I think individualized care, learning early that every child is unique and every child requires a different set of circumstances. What works for one child will not work for another. I think that's really a lesson that you learn early on with pediatric dentistry and one that you carry with you from day to day. I still think at the end of the day, after all these years, I can look at a situation and say, that child needed something different than we provided them. And I think that's really it. I think looking at each child as a unique situation, what works for some won't work for others, is really a great take-home message for anybody who's working with kids.
Definitely. And as far as people who are looking for a pediatric dentist, what are some of the things that they should be looking for? What kind of questions should they be asking?
I think you want to look for a practice that is personalized, just like we talked about, treating each child as an individual, treating each child as a unique person. And I think feeling comfortable with the doctor and the quality of care. We see lots of second opinions where they come in and they say, I didn't even see the doctor, and the dental assistant told me that they had all these cavities. Can you confirm that they're there? Can you confirm that they really have them? So I think feeling comfortable about who you're seeing and the quality of care you're getting is really important. And I always tell parents, if you have a hunch that something's not right, get a second opinion. You may hear exactly the same thing a second time, but it never hurts to hear it a second time if you have any doubt at all. So I think that's really important, is just trusting your gut and making sure that you're getting the care you need. One thing that we do in our practice that I think is a bit unique is encouraging parents to be with their child. I think the old-fashioned pediatric dentistry, parents didn't come back while the kids were being treated. And to me as a parent, that just seems unusual. You go back with your kid everywhere else you go. You go to the pediatrician with them. You go everywhere with them. Why would you not be there for the dental visits? So we encourage all of our parents to come back. And for me, it really helps because I can open the kid's mouth and have the parents look in with me to see what's going on. I can show them x-rays, I can show them things clinically, and I can educate them as to what I see. So I really appreciate it when the parents are back and they're involved in the visit as well. Anyway, so coming back with the child is really important. Being able to see the facility, to see what they're doing, to be involved in your child's care, I think is critical.
Okay. So if somebody wants to get hold of you, Dr. Cassinelli, what is the best way for them to do that? And where is your practice located in Atlanta?
So my practice is in Sandy Springs, close to the perimeter, right where 400 and 285 intersect. We are always accepting new patients. We can take patients via phone or by website. So our website is peakatlanta.com. And you can put in an appointment request, or you can call the office at 770-274-4428 and schedule a new patient visit.
Excellent. Well, Dr. Aimee Cassinelli, it's been a pleasure talking to you this morning. Thank you for all the great information that you have given us. Obviously, taking care of teeth is extremely important, whether you're an adult or a child, but these habits are developed as a child. So you got to make sure that you're doing the right thing. And any parents listening to this, make sure that you're getting your child to a good pediatric dentist. So Dr. Aimee Cassinelli, thank you very much for being my guest on Expert Profiles Atlanta today.
Thanks, Neil.
And to our listening audience, if you like what you hear, hit that like button and share, and we'll see you next time on the show.
Thank you for listening to Expert Profiles Atlanta with Neil Howe. To learn more about the resources in the show or to listen to past episodes, visit expertprofilesatlanta.com.